We begin tonight with team coverage out of North Idaho. Pediatric doctors at Kootenai Health are warning that cases are getting worse and they are lasting longer for patients. Also, a mask policy for Coeur d'Alene schools is still nowhere in sight. Our Amanda Rowley tonight will give us an update on where school board members stand right now.
But first, we start with our North Idaho coverage at Kootenai Health. Hospital leaders say the capacities are still high and putting a strain on the system. Our very own Ian Smay was at that press conference. He joins us live with more on what the pediatric doctors are seeing in local hospitals. Ian.
Tom, Whitney, Kootenai Health was treating 112 COVID-19 patients as of earlier today, with 43 of them in critical care and 16 needing ventilators. But the doctor that spoke today focused on how they are now seeing more severe cases of COVID-19 in children. Kootenai Health said in a worst case scenario, they could handle 15 more severe pediatric patients as of today. Doctors here have been preparing for a surge in those pediatric patients due to the start of the school year and the lack of mask mandates at many schools. All of the pediatric doctors that spoke today said similar things, that districts should be implementing mask mandates along with distancing and regular cleanings. This comes as a doctor at a local pediatric clinic said they've seen a huge increase in children with COVID-19.
Currently in our clinic, we have had a 200% increase in the number of COVID positive patients in just our clinic alone. Those have ranged from mild illness to pretty severe illness. We have had patients admitted as young as a few weeks old, all the way up to teenagers with severe symptoms.
Here at Kootenai Health, doctors say they are treating children with COVID today, but none of them are requiring ventilation. They also say they are seeing more cases of severe illness in children in the past couple of weeks as compared to earlier in the pandemic, and some have required transfer to hospitals in Spokane in order to receive higher levels of intensive care. And part of the reason for that need to transfer more severe patients to places like Sacred Heart is the fact that Kootenai Health does not have a dedicated pediatric ICU. One doctor said that a trend we're seeing nationwide is pediatric cases starting to get better, but then the kids get tired and they start to decline. And because of that, they'll need more intensive care such as ventilation, which is best done in a pediatric ICU. Coming up at 5 o'clock tonight, I'll have more from local pediatric doctors on what they're seeing in our local hospitals. For now, back to you.
All right, Ian, thank you very much. And while Kootenai Health is seeing a surge in cases among those younger children, we did want to know what it would take for the Coeur d'Alene School District to approve a mask requirement. This remains a very controversial topic all across the district.
KREM 2's Amanda Rowley shares where board members stand since its last meeting. Amanda.
Yeah, Tom and Whitney, just last week, the Coeur d'Alene School Board of Trustees approved a reopening plan, and it says masks are strongly recommended but not required in its schools. The plan passed 3-2, which is how the vote has remained at the last several meetings where masks are concerned. Now, a mask requirement must be approved by the Board of Trustees, and we know that the chair and 2 other trustees oppose requiring masks, and only 2 trustees support the mask requirement in its schools. I was not able to connect with the trustees for additional comment on this today, but we did learn more about their stance on this topic from last week's board meeting. Chair Jennifer Brumley asked if Washington and Oregon are in a COVID crisis, even with a mask mandate. Are masks really the answer?
For Spokane hospitals, there are 224 COVID-19 patients being treated for the virus. All elective procedures have been halted at all 4 hospitals, and surgical staff have been diverted to crowded emergency rooms, intensive care units, and COVID wards. Similar statistics are coming out of Oregon. So the question I ask is, if you have 2 states that have mask mandates in place and they are under the same crisis, maybe we're looking in the wrong place.
Now, the trustees who do support a mask requirement voted against the reopening plan, but not just because it did not include a mask requirement. They are concerned that other safety measures are not strong enough to make up for not requiring masks. Now, in addition to this discussion, Kootenai Health sent a letter urging the school board to adopt a mask requirement. It's a letter that 120 physicians and healthcare workers signed. I'll share those details and more tonight at 5. In the newsroom, Amanda Rowley, KREM 2 News.